I'm going to start this presentation with a glass half empty perspective. We will end with a glass half full perspective. So here it is. No matter how fluent you are in your working languages, there will be times when you will have trouble with a word or a concept. You will run into a word you don't know or a word you understand in one language but don't know how to transfer into your other language. And sometimes you will understand a word or concept. You will be certain you know how to transfer it into the other language, but you won't be able to get it out in the moment. It might be right at the tip of your tongue, but you just can't get it out. Other times a speaker might be speaking a language you are certain you understand and also speak, but you will not be able to make sense of what they are saying or extract the meaning of their message, either because they are using terminology and concepts that are unfamiliar to you, or because you don't have enough context to be able to extract the meaning of their messages and confidently deliver an equivalent message in the target language. Okay, these are facts. There are barriers that even the most expert interpreters face. What these are not are impenetrable, nor are they reasons that should prevent you from continuing to interpret. I want you to pay special attention to this. A trained interpreter who has been trained on interpreting protocols and is able to and skilled in applying them is never stuck. That's right, I said never. Because a trained interpreter knows that there are ways to work around barriers or sticky situations. But most importantly, there are ways to minimize how often this happens. And that is what we are going to explore in this presentation. Okay, but first we're going to do a quick review of what we discussed about context in the previous lecture. I'm going to ask you to interpret the following utterance and write down your interpretation on a piece of paper. The utterance is, "Let the baby out." Okay, now you may have been able to interpret this because you know how to say baby, and you know how to say let or allow, and how to say out. You might even be able to put these together in a grammatically correct phrase in your language of service. For example, in Spanish, we could say, "Permítele al bebé que salga." But I do hope that you were at least a bit confused or found it difficult to make sense of the message. At the very least, I hope that you were unsure of your interpretation, because even though you can come up with the words in your language and deliver an interpretation as you analyze the message only by the words it contains, you realized that you would have to put together a message that expressed the following propositions. There is a baby. The baby is locked somewhere, unable to leave. Someone has given a command to allow the baby to come out. If you are confused, believe it or not, that is a good thing. It's a good thing because it means that by now, with the help of a hairband and their hit from the 90s, you know that a message is composed of more than words. A message includes other parts that also carry meaning. And hopefully you realized that without those other parts, you did not have the entire message, which means you cannot come up with an interpretation you can be sure is accurate. So let's analyze what you do have. At the moment, all I gave you were the words in the message. But that's not all you have, because you do have your own background knowledge. And even if we do not share the same culture or background, locking a baby in a room is unusual behavior for anyone. The words I gave you combined with your background information should have let you know that you would have a problem transferring this into another language. And actually, a baby or a neonate wouldn't be able to leave a room even if they were not locked in it. So that doesn't make any sense either. So this is further proof that you might be missing a part or parts of this message. But let's say you work through it by just saying the words I said in English into your target language. I hope you were at least concerned once you said them out loud, which would mean you monitored your output. So what should you do in this case as an interpreter if you cannot be sure that you understood the message completely and you cannot then be sure that you are going to deliver an accurate interpretation? Okay, let's try another sentence before we answer that question. This time, I will give you some context along with the utterance. Here's the context first. This message is being spoken by a provider to a patient. So now you have some relational context. And this conversation is taking place in a healthcare setting. So now you have some environmental context. Now listen to the utterance. We are going to schedule your cabbage for this evening. I will say it one more time. We are going to schedule your cabbage for this evening. Okay, so let's analyze it first. I did say that you have some relational context, not all, because I only told you that the relationship between the participants was a patient-provider relationship. But you don't know if this is the first time they have ever worked together. You don't know if the provider is a nurse or a doctor or a scheduler. You don't know if the patient is a child, a person in their teens, 20s, or older. Now, you also do have some environmental context, not all. You know that it is a healthcare setting, but you don't know specifically if it's an outpatient clinic, for example, or if it's an inpatient and the conversation is happening in the patient's room. You don't know that either. But what you do have is the utterance. And here it is one more time. We are going to schedule your cabbage for this evening. Okay, so I'd like you to interpret that and write down your interpretation. Okay, so my question to you is, were you able to interpret the sentence? Now, a second question is, if you were the interpreter in this situation, do you have enough information to interpret the speaker's intended message accurately? Okay, the answer is yes. Now, what I would say if I was in your shoes is, wait a minute, what if I don't know how to say the word cabbage, or I don't understand the word cabbage in the message? Well then, that means that you listened to the message, and as you tried to extract the meaning, you recognized a problem. So now that you know there is a problem, you will need to state the problem so you can decide what you will have to do to fix it and then continue interpreting. And this is how we're going to do that. Because if you remember, at the beginning, I told you that interpreters are never stuck. So first, we're going to recognize that there is a problem, which we did as we tried to extract meaning, right? We need to then state the problem, decide on a solution to the problem, apply the solution to ultimately fix the problem, and then check to be sure that the problem was fixed. In order to be able to identify exactly what the problem is, let's take a look at the steps for message transfer. So let's figure out what step has that barrier. Okay, so the first step of message transfer is to listen to the original message in the source language. Well, we did listen to it, we heard it, and we tried to understand it, so listening was not an issue. I don't need, for example, the speaker to repeat it, because if I asked them to repeat it and they said the same words, I still wouldn't understand it, so that would not fix my problem. The next step is extracting meaning. And this is where I had a problem. Because even though I can find the meaning for each individual word separately, once I tried to group them together, once I tried to reformulate, to put together an equivalent message in the language of service, I realized that the word for cabbage that I know in my language of service, from the verbal context, wouldn't make sense. So that means that I may have misunderstood the term, or the word cabbage has another meaning that I don't know. So I need to ask the speaker, in this case the provider, to clarify that term for me. Okay, so then now the speaker says this: cabbage stands for coronary artery bypass graft. Okay, what if I still don't know how to say that? Again, I listened and I heard it again, but I'm still unable to extract the meaning of cabbage in this context in order to find an equivalent concept and reformulate a message into the target language and deliver it. So what do I do now? Well, the same process, because I still have a problem. So I will need to ask for clarification again. Okay, so in the second round, the interpreter, me, still needed clarification for a term used by the speaker. That's the problem that I had. So I recognized it. I'm stating it. The solution I came up with was to ask the speaker to clarify or explain the meaning of the term. Now the speaker says a coronary artery bypass graft is a procedure to create a new path for blood to flow around a blocked artery in the heart. This is how I'm going to apply the solution. This is what my interpretation is going to sound like. We are going to schedule you for a procedure this evening. The procedure is known as CABG in English and is performed to create a new path for blood to flow around a blocked artery in the heart. So I was able to apply my solution and confirm that the problem was fixed with that clarification that I received from the speaker. All right, and just like that, I hope that your glass is now half full. Actually, we're going to fill your glass all the way up because from this exchange, you have learned the acronym CABG and what it stands for. You have learned the purpose of the procedure. This is extremely helpful because the definition of cabbage is not common knowledge outside of a medical setting, which means that providers are very likely to explain it to patients, which makes that likely that you will have to interpret for a patient receiving this information. And now you will have context, background information, that will make finding equivalency in another language easier. So you will be better prepared to interpret this explanation in the future. But most importantly, received for the rest of this encounter, the situational context that you need to make it easier to extract meaning from the messages the participants are going to exchange in this encounter. Situational context describes the reason why something is occurring and the appropriate behavior and actions associated with the situation. It's one of the types of context that influence communication. And it's going to be a huge help because when it comes to relational context, you're not going to have that relational context completely ever. You might be able to label the type of relational context someone has, but you will not have the information that these two individuals have because of that relationship. But now, because of situational context, you know the purpose of this interaction, you know the topic that is being discussed, and you know the roles of each speaker. And with all that information, you can now even start anticipating utterances you may have to interpret. Now you can use even more of your background knowledge. For example, if you have interpreted previously for an encounter in which a patient was being scheduled for a procedure, now that you know that the topic of this encounter is scheduling a procedure, you might be able to recognize or anticipate some of the questions that the provider might have for the patient. If you have experience in this kind of encounter, you might also be familiar with some of the instructions patients are given before a procedure and be able to anticipate that, as well as any paperwork that will need to be completed, for example, a consent form. Or you might know what kinds of questions a patient might ask before a procedure. And even if you have never interpreted in this type of situation, you still might have some background knowledge you might be able to use. Maybe you know someone who has had a similar procedure or any other procedure. Maybe you have had a procedure yourself. And even if you don't know anyone, you've never had a procedure yourself, never interpreted in this type of encounter, you do know what kinds of questions or worries you might have in this situation. All of this is background knowledge you can use to make the process of extracting meaning and finding equivalency easier. Okay, so let's go back to the first utterance, let the baby out. I originally didn't give you any context for this one, so here is some context. This is an utterance between my daughter and I we are just coming home from school and work, and as soon as we are home, I say to her, let the baby out. Okay, just take a second now that you have a little bit more context and decide if you would change anything from your original interpretation. Now, before you start worrying that I keep a baby trapped in a room while I'm at work, let me tell you what I expect my daughter, the listener, to understand from my intended message. I expect her to understand that I mean that she needs to open the door to the spare bedroom so our dog can leave the room, escort him to the northeast corner of the backyard, wait for him to urinate, then walk back in the house, making sure he follows her in. Because if he doesn't, he will go pee on my vegetable plants and flowers. Now, why am I able to communicate this message in this way? Because my daughter has access to all the parts of the message that compose its meaning. She can see all of the sides of the crystal, as Isham might put it. But you do not. You have the words, the content, you have some general knowledge about the environment, which is my home, and the relationship between the speaker and listener, which is a mother-daughter. But this is still not enough. Because even though you know what the relationship is between she and I, you do not know the context that that relationship carries with it. But I do, and that's why I was able to phrase my message in the way I did. Okay, I don't want to feel like I'm beating a dead horse because by now, I trust that you already understand that there are other parts to a message you must analyze in order to get its complete meaning. But I still use this example to point out that interpreters have to be 100% sure they understood a message in order to be accurate. And you will find that most of the times as you become a trained interpreter and accumulate experience, you will have the abilities, skills, and knowledge to understand messages completely. But as I have mentioned previously, when we interpret, we have to focus harder, listen better, and overall work harder to process messages than in our day-to-day communication. You have to because it's required to ensure the accuracy and completeness needed to support the communicative autonomy of the participants in the encounter. Okay, now please listen up because even though I realize we have taken many side roads, we are still on the path to discuss the skills required for accuracy and completeness in interpreting. Now, those side roads were important because along those side roads we took, you learned that interpreters transmit messages completely without leaving any part of the message out. They do so with accuracy and transparency, which means they transmit exactly what the speaker has said in the exact way the speaker has said it. You should also understand by now that this is why we had to discuss the fact that a message has many parts to it, which made it necessary to take the time to identify all the parts of a message in order to transfer messages without leaving any part or parts of the message out. These parts of a message include the words, body language, nonverbal communication, context, register, tone, and culture. Okay. So far this has been the theory that you need to understand in order to identify the skills that you need to develop in order to interpret. So let's now pair up that theory with the practical. Based on what we have learned so far, here are some abilities that we know we must possess into 3 categories. These are the abilities we need to have in order to be able to interpret accurately and completely, in order to be able to conduct message analysis, and in order to fulfill our role and practice within our scope of interpreters. So you need to be able to hear speech and produce speech. You need to be able to extract meaning from messages that you hear. You need to be able to recognize and understand regional dialects in both languages. Now, we didn't go too far into this, but we will soon. You also need to be able to understand and produce messages across linguistic registers. You also need to be able to make decisions following a decision-making process for healthcare interpreters. The skills you need to have require fluency in both languages, and you already knew this. Active listening skills, memorization, note-taking skills, self-monitoring, and the skills to speak with various degrees of formality. For message transfer, we need message analysis skills, skills to be able to find message equivalency, syntax or grammar skills in both languages, and to be able to fulfill our role as interpreters, we need to have effective communication skills, critical thinking skills, and interpersonal skills. Now, the knowledge that we need to accumulate and build and strengthen throughout our career for accuracy and completeness includes a wide range of vocabulary, medical vocabulary and terminology, general understanding of common body processes, general understanding of common signs, symptoms, and disease processes, the interpreter code of ethics, and the standards of practice. We also need to have knowledge about the cultures that are associated with our working languages, the Western biomedical culture, and cultural humility. The knowledge we need to have in order to ensure accuracy and completeness, we need to have knowledge of a wide range of vocabulary, both general and medical. We also need to have general understanding of common body processes, a general understanding of common signs, symptoms, and diseases, and the disease process, code of ethics, and standards of practice. Now, just to go back to general understanding of common signs, symptoms, and disease processes, I do want to mention that this information is going to be helpful to fulfill your role as an interpreter. We are not going to learn this to be able to diagnose or give prognosis or medical advice, but it is going to be very helpful to our interpreting. We also need to have knowledge of the cultures associated with our working languages, as well as the Western biomedical culture. And then to be able to fulfill our role and stay within our scope of practice as an interpreter, we need to know about cultural humility. And finally, the last category is protocols. These protocols are protocols that were established to ensure that interpreters practice in a way that actually fulfills their role. They are also a way for the interpreting profession to practice in a standard manner. So that if I am a patient and for one of my appointments, I have an interpreter A, I can expect the same level of professionalism, the same practices from another interpreter at another appointment, interpreter B. So protocols to ensure accuracy and completeness include using the appropriate mode for the encounter, and we will learn the different modes of interpreting. The voice the interpreter uses while interpreting using the first person. The reason why that protocol is established is because we know that it supports accuracy and completeness. We also need to learn the protocols that are required in order to properly intervene to ask, for example, for repetition. For message analysis, we also have protocols that support that, such as intervening techniques to ask for clarification, like we practiced earlier in the presentation. Also, intervention techniques to ask for an explanation, which we also practiced. And then, of course, there are protocols that are helpful for us as interpreters to remain within our scope and not step outside our boundaries, and to be able to communicate those boundaries and our scope to other professionals. Performing a professional introduction before the encounter with the patient begins, as well with the provider, where to position ourselves if it is an in-person encounter, or where and how to ask a provider to position a camera or phone if we are doing remote interpretation. Intervention techniques to point out possible cultural misunderstandings. We also have protocols for that. Techniques to manage the flow of communication, and standards of practice for interpreters. This week, we are going to get started with practicing these practical skills. So we are going to start with looking at the voice the interpreter uses while interpreting using the first person. We're going to discuss what that means, why we use it, and then practice using it. We are going to also write a professional introduction. We are going to also practice message analysis skills and the ability to extract meaning from messages.